Welcome back to another episode of the Braun Performance and Rehab Podcast, powered by ISOFIT and Oro Muscles. ISOFIT is my go-to for all things isometric strength training, and Oro Muscles is my go-to for an actionable muscle wearable that gives real-time live biofeedback on muscle activity. Today I'm joined by Regan Dewhirst. Regan is an incredible physical therapist, and her and I are going to be diving into physical therapy considerations for working with a downhill skiing athlete. So we go over a lot of different things, ranging from biomechanics to unique considerations to return to snow progression and so much more. This was an incredible episode, one of my favorites all time, and I really appreciate Regan's time. Enjoy. Regan, welcome to the podcast. I'm super excited to work with you today. Thank you so much for being here. I really appreciate your time.
Absolutely. I'm excited to be here and excited to share what we've figured out over the years and pick your brain too on what you've seen in the clinic as well.
I have a feeling this is going to be a lot more of me learning from you than you learning from me. But, for people who aren't familiar with you or all the amazing stuff that you're doing in the space of skiing that way, would you mind filling them in a little bit about who you are and all the great things that you've been able to do over the past several years?
Yeah, absolutely. So I am currently a physical therapist with the U.S. ski team. I'm based in Vermont, but I spend most of my time traveling with Mikaela Shiffrin and essentially working with her strength and conditioning team and her high performance team to basically implement any on snow, off snow needs while she's traveling. Prior to joining the ski team, I worked at an outpatient sports performance group in Vermont. And I think this was sort of my foundation. I did a residency through Arcadia University while I got started with this group. And it kind of gave me a really great starting point for biomechanical, taught me how to sort of demonstrate value to patients, build compliance, and sort of communicate with physicians and coaches. And then from there, I was kind of able to springboard and add sort of new layers of sports performance to what I was doing. After working there, I then went to TB12 in Boston, which was a completely different way of thinking. Not really what we necessarily got in school. It was very tissue-based with this concept of pliability, and gave me this framework of thinking about how to sort of lengthen and soften muscles so that the body's actually able to absorb and disperse force a little bit more easily. And I think that kind of complemented that biomechanical way of thinking really well. Sort of the beginning of my career was sort of more biomechanical based, and then I moved into more of the pliability tissue work. And I think that's been a huge addition to working with Mikaela and sort of prepping her for the loads that she takes on while she's skiing.
That's such an interesting kind of combination to have a very biomechanical, academic heavy background, and then also a tissue-based or more like practical hands-on, for lack of a better way to put it, kind of blend that way. And I think the two do go hand in hand together, but obviously you're very deep in the world of skiing right now. So I'd imagine you probably grew up skiing or have a little bit of experience in this space yourself that way.
Yeah, absolutely. So I did grow up skiing. That's actually how Mikaela and I first met back when we were 12, 13 years old. I kind of played every sport. I was into soccer, skiing, hockey, tennis. I really didn't sit still very well. But I eventually gave up the skiing so that I could play soccer in college at UVM. And it was kind of my time at UVM where I really started to realize how much I really enjoyed the human performance side of things. I kind of spent the summers with some amazing strength coaches. And that kind of gave me my first little experiment in like how loading different structures maybe affected my own performance. I also, during college, had the opportunity to ski coach kind of by accident. There was a local club that was looking for some female coaches, and I figured, hey, I get to be outside, I get to be with kids, I get to sort of look at these movement patterns, like why not? Not really thinking that it was going to be such a integral part to my career now. And then also in grad school, I worked with a couple of my professors where we did movement screening on Nordic skiers. So that was also sort of a nice foundation to sort of look at what are efficient movement patterns and what maybe are a little bit more compensatory, and like how are these athletes building power.
Yeah, no, that's a great point. And you brought up so many amazing things that I'm excited to dive into. But before we get to
all the real, nerdy, deep stuff, for lack of a better way to put it, I guess I got to ask, you've traveled all around the world. Where's your favorite places that you've skied at, or what do you recommend other people kind of check out from a skiing standpoint that way based on your own personal experience?
Oh, that's such a good question. I love domestically, I absolutely love Colorado. I mean, you've got big, wide open trails. The snow is dry. You kind of feel like a hero skiing on that. I'd say internationally, Italy is super cool. Same thing, like the Dolomites are an incredible area and just really cool terrain.
It's awesome. I'm going to have to add those places to some of my places that I want to get to, so to speak, that way. I have not skied out of the country yet, so that's on my bucket list of things to do very soon here, hopefully. But you brought up the point a minute ago about how complex skiing is from a movement standpoint. And I think I see this a lot in providers and practitioners and even strength coaches, is a lot of people have seen people ski, but they're not overly familiar with the sport, or, maybe they live in an area like I do now in the middle of nowhere, Maryland, where skiing is not really as big as it might be in a place like Colorado or Vermont, but we still get the recreational skier on occasion that way. And I think that having a firm understanding of the sport, what it is, what it looks like, the mechanics that go into it, and so many of the other considerations surrounding the sport is just as crucial for us to be successful as it is for all the other sports that we, work with on the day-to-day that we know very well, like a lacrosse or a football or a soccer or that sort of thing. So when it comes to this whole concept of skiing, for people who aren't familiar, would you mind just kind of breaking down the different disciplines within the sport, right? Obviously throughout Nordic, and there's Alpine and different things that way. So what are the different types of skiing that you typically see people do that way?
Yeah, absolutely. I think being on the Alpine side of things, I can kind of talk to that a little bit more clearly. But the idea is sort of this carved turn, and you've probably felt it, but it's sort of the most fun aspect of setting the skis on edge, building up pressure, standing on the downhill ski. You basically load the ski, it creates power, and then it propels you into the next turn. So if you think of kind of the classic photos or sort of Olympic photos of athletes, it's usually when the athlete is right at the gate, their skis are pointed down the hill, and their body is completely separated. So their trunk and their shoulders are upright, they're facing down the hill, but their feet are about as far away from their body as they can. And that's what kind of builds the force and builds the power to be able to push into the next turn. I think when we look at it from a performance standpoint, you can kind of break up that turn into 3 different phases. So think of it almost like a C, and the gate is in the middle of the C. At the top of the turn, you sort of have your initiation. So that's kind of when you're just barely starting to shift over the outside ski. You're sort of going into almost like a single leg squat. And then the feet, sort of through the bottom of the forefoot and the ankle, are starting to direct the ski in the direction where you want to go. From there, the athlete starts to roll the knees in a little bit more. And then they get to sort of the apex, which is sort of that middle phase of the C. And that's when their hip is nearly touching the snow. Their inside hip is maximally flexed, and their outside ski is maximally extended. The forces here are pretty high. So we actually see that the torso has to rotate almost away from where the skis are going to create a stable base of support. And as you can imagine, that puts a lot of stress on the obliques, QL, paraspinals, all those trunk muscles trying to kind of resist those G forces. At the end of the turn, that's when the athlete actually starts to provide a little bit more of a concentric force. They move upward, the hips come up, skis kind of come flat underneath them, and then they do the same thing going into the next turn.
I feel like you broke that down really well. And it's so interesting when I talk with people about skiing that way, and I tell them, if they're not familiar with the sport, that they actually have to lean forward as they're going down the mountain. It kind of like blows their mind. They're like, wait a second, what do you mean I have to like go downhill while leaning forward? Like, shouldn't I lean back so I don't fall down? So it's one of those things that I find is always like a little bit of a shock for people. And I feel like we'll get into this later, but I feel like that's one of the things that we need to keep in mind when we work with athletes on the rehab side of things. It's just how much pressure we need to have facing forward as we go down the hill, and the shin angles that we need to achieve, and so on that way. as you were talking as well, you brought up the torso and the hip rotation and the incorporation there as well. And obviously, I think that when everyone thinks of skiers and rehab and injuries, the ACL is like one of the first things that comes to mind that way. And obviously, there's a little bit of a trunk lean component to that. So, is that the reason we see so much in skiers? Maybe, maybe not. But it's one of those things that I think we just need to be aware of what the movement should normally look like and what the movement might look like when it's less than optimal, for lack of a better way to put it. And I find that, what that movement looks like in skiers varies on the day to day, right? Maybe they're just a little bit more fresh. Maybe they're a little bit more fatigued one day. Maybe it's a different kind of condition. But, I don't feel like a skier is going to ever recreate the same run every single time that they hit the slopes.
No, that's a really good point. And I think with that, because there's so much variability in the terrain, the visibility, the equipment, the course set, like there's never going to be one course set that matches another course set. I think when we look at stuff that we might do with an athlete in a clinic or the programming, there really needs to be a lot of variability. And there needs to basically be training so that the body can kind of figure out where it is in space and react extremely quickly. At the end of the day, you're doing this as fast as you possibly can. And like you said, if you start to get back or off balance in a backward position, that's really when you start to run the risk of an ACL tear. The most common sort of positioning to tear the ACL is when an athlete gets pushed backwards. They often don't have the core strength to stay over the outside ski, so their body actually drifts onto the inside ski, which is fine. They can kind of hold that for a second, but the outside ski loses contact with the snow. And then when they try to reestablish that contact, the construction of these skis now are so aggressive. The edge can basically hook up, you throw in a valgus movement, and then you see the ACL unable to withstand that force.
It's interesting you bring up the equipment considerations because, again, this is something that a lot of times people are familiar with other sports, right? Like I feel like a lot of people are familiar with running footwear or different cleats that athletes might wear. But then we talk about snow and all of a sudden it's like, wait, there's different types of ski boots. There's different types of skis and they all have different things that way. And I think that could probably be a long conversation within itself as far as what's important for the practitioner to know versus what's not necessarily a must know kind of thing, kind of a nice to know, but not a need to know. But when it comes to considerations surrounding, snow conditions, whether it's more of like a man-made versus a natural snow versus something that's kind of packed down and groomed really well versus something that's more kind of loose and fluffy that way, or the equipment, whether it's the width or the length of the ski or the skiing style of the skier as well. What kind of things do you feel are typically really important for a clinician to understand, as opposed to things that, maybe it's nice to know, but we don't necessarily need that in our practice?
Yeah, I think for the equipment, for what we're dealing with, it's sort of the athlete has boots, binding, skis. We're not going to be changing that for the most part. In terms of getting the athlete onto snow and sort of in a return to snow progression, I think understanding, okay, what trail are you going to be on? What's the profile of the trail? Is it steep? Is it flat? The steeper it is, we know the forces are going to build up. Is it groomed? Is it maybe more dry snow that might be a little bit more forgiving? Has the mountain injected water into it? The water injection is nice because it's a very consistent surface, but it's basically like skiing on a skating rink. So the speeds are higher, the load is significantly higher. And then if it's groomed and watered, you actually get quite a bit of vibration. And we know that's kind of the highest peak forces. So if you're getting an athlete back early, I would recommend keep them off of the water, start on something that's dry, groomed, flat terrain, and then you can kind of build up in the actual pitch from there.
I think that was a great breakdown, and maybe this is a little bit too nuanced of a thing to pay attention to, but I had one skier that I worked with a while ago, and once we were starting their return to snow progression, kind of getting them, out of the clinic and back on the mountain, so to speak, one of the things that we actually had to look at closely was their DIN settings, because believe it or not, their body weight changed after surgery that way. And I think that's another, maybe it's too nuanced, but just something to be aware of is, essentially the bindings themselves has a DIN setting that's, adjusted based on the body weight of the skier. And if they're too heavy or too light based on the DIN setting, then the ski will either pre-release or not release when it should. And obviously you want that dialed in as best as you can, especially if you're just starting to get someone back on the snow after they've been off for, a prolonged period of time that way. And that could be something even for the skier who doesn't miss time and maybe didn't have something significant like an ACL injury or something that way. But, if their body weight changes from one year to the next, like, say they pack on 20 pounds of muscle because they got in the gym, like understand that there's going to be a difference in some of the different settings and considerations that we have to put into things from a skiing performance side of things, I guess.
Yeah, absolutely. And I think if the athlete has multiple pairs of skis, in terms of getting them back and starting that return to snow progression, putting them on something that's a little bit lighter and a little bit shorter, almost like kind of a free ski type ski. And that way you can kind of start to simulate the demands of the sport, but you don't have a really heavy, long race ski that's going to have more torque and more force. Actually considering something a little bit lighter that's a little bit easier to turn to get started.
Yeah, and you mentioning about the demands of the sport that way, I think people often underappreciate how magnificent skiing really is when you think about it. You're going down a really steep slope that's probably got some level of ice or, frozen water to it. You're leaning forward. You're putting a ski on a really sharp edge. And if people don't believe me about how magnificent that is, try to walk up a ski slope in the summertime because it's a lot harder than you think. And oh, by the way, while you're doing that, you're achieving speeds of, 50, 60 miles an hour, sometimes even faster, and you're still hopefully in control while doing it. And it's one of those things that it's just like, no human is ever going to run that fast. No one's ever going to bike that fast as long as you can, on skis that way. So it truly is a remarkable sport, but understanding that just because it's so unique in the demands that it puts on the body, that we really have to, prioritize and emphasize getting someone back to a higher level of function if injury was present in this population because of how demanding on the entire, body system it really is.
Yeah, absolutely. I think kind of going back to each of the phases of the turn, you can kind of start to think about what areas you need to train to hit those demands. And I think starting from the ground up, foot and ankle control is hugely important. Most of the ground reaction forces are going to come through the midfoot. So single leg balance on different surfaces, different visual challenges. Plantar flexor strength is huge. Like these skis are not light. They're quite heavy. So being able to actually turn them, you're kind of driving through your toes to keep yourself forward. And then one thing that I think is often overlooked is actually anterior tib strength. So not only are you pushing your body forward, you're really pulling your toes up to kind of keep your weight up against the front of that boot. And oftentimes when we pick back up in these camps, we see really significant anterior tib strain because it's hard to kind of simulate that type of load throughout the summer.
I was going to say it's such an interesting and unique point because you're right, you're slamming the shin forward into the front of the boot. And on top of that, when you are starting that turn, I'd imagine you see a little bit of eversion in the outside, the foot that's on the outside, whereas you get inversion on the inner foot. And then that angle is obviously going to increase as you continue the turn, right? You're going to see more inversion on one and more eversion on the other. And it's almost like this coupling of movements on one side versus the other. So it's like, we get this extreme shin angle. We're driving shin into a rock solid boot, or likely a rock solid boot. And then on top of that, we're actually adding that inversion, eversion component to it. And it's so funny because a lot of times people will tell me, well, it's skiing. So, the boot kind of takes the ankle out and everything's at the knee. And it's like, no, there's actually a lot more going on at that foot ankle complex than I think we give ourselves credit for. And on that note as well, I think if you look at some of the drills that you'll see younger ski racers doing, or some of the drills that I remember doing that way, it's like, there's times when you unbuckle your boots fully and you ski neutral in the boot. And it's so challenging when you first try it because it's like, oh, shoot, like, I really have to pay attention to what my foot and ankle is doing. Or, on the flip side, try skiing on one ski and see how you respond to that as opposed to on two skis. And, again, that might be a little bit too off into the weeds on like ski drills and on snow drills that way, but I think it's important to kind of consider what these athletes have been doing to get to the level that they're at that way.
Totally. I would say that's actually a huge focus. And I think when you look at a return to sport progression, you absolutely should be having the athlete working one ski, practicing with boots unbuckled, maybe some buckles, but basically training that active control. So you're not just relying on the passive equipment or passive structures to kind of get you where you need to go. And I think the foot component is, when you start to look at a performance standpoint, that is the performance. If you don't get your foot and ankle going at the beginning of the turn, you're basically, you're going to lose force. You're going to lose force down the hill, and you're not going to be able to kind of keep yourself on the line that you want to be on. So foot and ankle, especially working inside the boot, is a really important piece of the foundation. And then as you kind of come up the chain, really being able to hold that, it's basically a reciprocal stance, right? You have the inside leg that's getting as short as it possibly can. So you have to have a ton of hip flexor strength. And then the outside leg is pretty much as long as it can. So it's glute strength, it's hip strength, and then lateral trunk control. So you're basically making a C shape over that outside ski to stay stacked down the hill there.
And as you mentioned before, obviously that puts the body through a lot of, like, I think the word is centrifugal forces or some kind of rotational forces. I'm not the science guy here by any means, but I know that obviously when you lean, the center of gravity and the force lines change quite a bit compared to what we normally think when we're upright.
Totally. And sort of like what I got to see quite a bit with those adolescent skiers that I worked with back in college and PT school is a common mistake is that athletes want to lean in. They don't have the core strength to keep their shoulders level. So they get sucked almost into the same plane as the hill. And basically, if you do that for too long, you're just going to wind up either sliding out or even falling, because you can't control, especially on an icy surface, you can't keep the grip on the ski. You're just going to kind of get pulled by gravity.
Yeah, and interestingly enough, we mentioned the ski drills a second ago. One of the ones that I distinctly remember for that was I would have my ski poles, hold my arms out in front, kind of like a zombie kind of position that way, and either rest them on my shoulders or on my fingertips. And it was like, you've got to ski down, don't let the poles fall off the side that way. Obviously you're motivated by the fact that if the pole did slip out of your hands, now you've got to try and get back uphill on skis, which is not the easiest thing to do to get it. But on top of that, it really kind of taught that like neutral up top kind of position. Essentially, I think you need a certain level of, I believe the term is disassociation between what the upper half of the body is doing and what the lower half of the body is doing. And you're absolutely right. I see that as something that a lot of people really struggle with. And I don't know if there's any studies on this, but I'd be interested to see comparisons of athletes who grow up skiing year round in one of these places where there's always snow versus athletes who, maybe grow up in the Northeast where, we have our ski season and then summer rolls around and there's no snow in sight, to see if there's any differences that way, or if, multi-sport influences, play a role in that as well. But I certainly think that element of being able to control the upper half of the body while the lower half of the body is really experiencing chaos, or, I guess I could make the comparison that it's almost like ballet on snow for how artistic and smooth it should look if done properly that way.
That's interesting you say that, because especially once I sort of started with Mikaela and started in this world, there's not really a ton of research. So I actually looked quite a bit to dancing, gymnastics, and rowing, and to sort of see what they've done as well, because you're basically requiring these athletes to use an entire range of motion and kind of get to these extreme ranges, but they're resisting so much force at those end ranges. So not only are they getting into those positions and they need the flexibility and the mobility to get into the positions, but they have to be strong there too. And I think that's kind of the missing piece. I think for so long it was like, okay, if the athletes are strong in a neutral core position, then they're good to go, or like we're building tissue capacity. But really, I think that's not quite enough. It only gets you so far. Yes, there's a baseline amount of strength that you need in those neutral ranges, but then beyond that, it's kind of that nuanced mobility versus strength.
Completely agree. And on that notion of the nuanced mobility versus strength, the extremes that you have to go to for a sport of skiing that way, from a rehab standpoint, I feel like, early stage post-op knee or whatever joint that way, my rehab approach is pretty much unaffected. I might include some additional things on the uninvolved leg, but obviously there's only so much we can do when we have very high level of restriction and precaution on joint or on tissue that way. But once we get into the mid-stage level, I feel like personally, this is where you can start to get a lot more creative and incorporate a lot of those more, like, I guess you could call it skiing specific or activity specific kind of things. But in reality, I think it's just kind of using what you already have access to load tissue in a way that has a little bit of carryover to what they want to do. I think that athletes buy into that concept a lot more readily than they would just kind of like going to the gym, because a lot of athletes that I've worked with, especially in the skiing space, I'll say we can sometimes be a little complex to rehab in the sense that not every skier likes going to the gym. Not every skier wants to, lift weights. They just want to hit the slopes and do what they do. So if you can kind of use things like, I like slant boards a lot, for example,
Yep.
kind of mimic that kind of downhill or downward kind of angle as best as I can that way. I think you get so much better buy-in from the athletes that you work with.
Absolutely. I think, like you said, slant boards at an angle too, where we'll use like a landmine setup where they're actually kind of loaded into a lateral position and they can sink into the hill. I think using bands, that eccentric overload, I think remembering that skiing is not necessarily just plyos, it's actually more isometric, slow eccentric, slow concentric, and sort of considering the actual timing of the muscle firing and knowing what sports your skier is doing. Are they a tech athlete, slalom and GS, where they maybe are turning every 1 to 2 seconds, or are they a speed athlete where they're turning maybe every 2.5 to 3 seconds? And really our programming should kind of mimic that at times so that they're able to kind of turn the muscles on slowly, resist the forces, and then create power out of it versus just bouncing from side to side. I would say I like one of the tests that we do. It's actually part of the fitness testing, and it's a standardized fitness test with the ski team, is a single leg squat. But one of the rules is that the hip actually needs to drop below the knee so that we're kind of simulating that full hip flexion. So we're getting an image of where their strength is at, but really we're getting an image at where their control is at. And we're looking at pretty high reps too. So what happens once the athlete gets fatigued? Are they breaking down in their back because they don't have the hip mobility? Or do they not have the frontal plane hip control after rep 14, 15? Are they starting to go onto their toes or their heels? Positions where we can actually simulate that maxed out reciprocal stance is really helpful in looking at how prepared these athletes are.
Right. And I'd imagine there's a delicate balance that comes with that, right? Because obviously you want things to look and feel a certain way as much as you can, but then you kind of look at it and understand, like, they're going to perform that way for a certain extent of time, but eventually the body will break down if they are fatigued enough and that sort of thing. So understanding that you want things to look a certain way. However, it doesn't always come out that way once they're on snow that way.
Yeah. And I think that even happens with Mikaela in our world. Like we might have a 15-hour flight. She comes off, hips are super tight, core's not quite firing as well as we'd like it to be. Obviously, we're going to do a warm up or sort of movement prep to get into a better spot. But I think recognizing that all days are not perfect. So that's where it's talking with the coaching staff to say like, hey, okay, we should not be on injected water today. And maybe we go on a little bit of a flatter surface, a little bit of an easier core set that controls the speeds a little bit more so we can still work on the timing and kind of the sport specific patterns, but we're not maxed out in terms of load and force when we're kind of managing the dysfunction for lack of a better word.
On this note, on kind of mid-stage rehab for the skier athlete with a knee injury, so to speak, you mentioned the landmine setup, and I absolutely love that one myself that way. I also do a lot of work with athletes on the just general rotational control and general rotational disassociation. Can we get the lower body to move, the upper body to stay still, and vice versa that way? And a lot of these different things, like we mentioned different skiing drills before that way, you can actually replicate different things where, athletes might hold a PVC pipe, or if you really want to go off the deep end and look cool on Instagram, I guess they could hold their ski poles out up front while they rotate down low or something like that in the clinic that way. Obviously, it's a little different since it's not on snow, but you can still get pretty creative in how you address those things. The other thing I found, and maybe this is just a personal nuance that way, but I found that this population in particular really benefits well from adductor strength.
Yes.
I think just in general, adductor strength is something we tend to forget about and overlook in athletes across the board, but especially the skiing population that way. Like everything we already talked about, the quad is really important. Eccentrics are important. Isometrics are important. But I also think there's a whole lot of stock in adduction here. Abduction, glutes, that's all important too. Don't get me wrong. However, I just think in general, we really underload and underappreciate how important that side of the body is, or that side of the thigh is, I should say, for hip stability and knee stability.
Absolutely. I mean, if you take that sort of apex of the turn positioning to maintain the edge contact on the outside ski, that adductor is working so hard. So I think part of our morning warm up every day, there's some component of a Copenhagen. And then what else are you doing? So like, are you doing an adductor plank with external rotation, internal rotation on the opposite side? Or do you have a band at your arm where you're actually doing sort of an outside arm punch so that you're getting some of that rotational component? Or are you keeping the legs stable and having the pelvis actually rotate over the femur? So they're kind of working some of that mobility and activation at the same time. 100%, I'm with you. I think the adductors are often overlooked, and I think that can contribute to sort of loss of control through the higher forces of the turn.
Yeah, I completely agree. And having all of those boxes checked before you get an athlete back on the snow is obviously essential. What kind of return to snow considerations do you typically have for the athletes that you work with that way? Is there like a certain cut score that you're looking for, whether it's hamstring quad ratio or adduction abduction ratio, that sort of thing? Like, what are the kinds of things that you look for before you get an athlete back on the slopes?
Yeah, I mean, I think it's pretty similar to the clinic and what you guys are probably doing there. We use force decks quite a bit, and we use it kind of through different phases. So as you progress to the next phase, you should be hitting 85%, 90%, 95%. We're looking at sort of isometric raw strength, and then jump testing, single leg jump testing, and then we kind of go into your traditional hop testing as well. I would say that probably looks the most similar to what the research is out there right now. Where it gets a little bit more ski specific, I think, is once you kind of get actually back onto snow and working on exactly what you said before. Like you're working on boots unbuckled, you're doing one ski drills. How does the tissue actually react to being loaded on one ski? Then you're kind of progressing into drills with variable turn shapes. Then you're going out when it's maybe a little bit more bumpy or foggy. So you're adding in sort of a visual challenge there. And then once the tissue kind of and the knee does okay with that, then you can start to sort of work into very easy short sections with just a few gates. If that goes okay, then we progress the athlete into more of a normal training session with other athletes there. Although maybe we don't actually start the timing yet. It's just see how it feels to actually turn around the gates. If that feels okay, mentally the athlete feels ready, then we'll start to introduce the timing at the end. So there's more of a competitive factor there.
I love that breakdown and progression that you just outlined, Reagan. And I think that it's essentially taking a lot of the concepts that people might typically think about in ACL rehab in the clinic and just applying them onto snow, right? We always start with a more controlled environment and progressively get more chaotic. It's just a matter of how do I do that on ski slopes as opposed to in a clinic that way. And to a certain extent, we can't control all of those things. So I think this is an area where the progression back is sometimes a little bit variable. Obviously, some athletes are under a big time restriction and they have to get back by a certain point. And sometimes this process, we do move from level 5 to level 10 a little bit quicker than we would like to sometimes. And other times we actually have the time and we're not in a huge rush and we can kind of go through each step of the progression a little bit better, in my opinion, where we don't, miss anything, whether it's going from clear day to foggy day or whatever that way. There's certain elements that we can't control. But perfect in a perfect and ideal world, we have the ability to control all of those different things and even more. You mentioned about the 15-hour flight earlier and trying to ski after that, a lot of times people that I've worked with, they'll fly out to Colorado or Utah or, Big Sky, Montana to get skiing in out there. But it's, they're going to fly for 4 hours, 5 hours, and then they're going to rent a car and they're going to drive 2 to 3 hours up into the mountains. And then, they're either going to start skiing that day or the next day. And it's like, how do I prepare someone to go from no movement for 8 to 10 hours to very intense, high demand on the entire body movement? And I think that the more you kind of like think with those things in mind and then get creative with what you can do, the better off you're going to be. I will also say that this is a population, in my opinion, that actually having some experience skiing yourself, you do not have to be the world's best skier. You don't have to be a Mikaela or a Lindsey Vonn or anyone like that. But if you have some kind of experience skiing and you're willing to go out with the athlete that you're working with on the slopes once or twice, it goes like to infinity for them. So understanding the impact that you can have by literally just taking interest with what the athletes that you're working with do on a day-to-day and showing them that you care enough to actually go out there and work with them on some of these things yourself.
Totally. I've actually done that here in Vermont with some athletes before, and you see things that you can't necessarily see in the clinic. Like, things are so controlled in the clinic. They're warm. They're on a flat surface. They aren't, maybe we test out the mobility in the clinic, but you're not going to be able to reproduce the exact sort of G-force type load that they're going to get as they're kind of coming through the apex of the turn. And I think when you get them out there, you can kind of show them different ways to modify the load. And I think any return, whether it's coming off of a break, whether it's coming off of travel or an injury, you still need to follow the same concepts as other sports. You go through the no load, the low load, the higher load, and then you kind of get to full performance where you can add in all of the other variables. But even when we come off of travel in a very micro cycle, we'll sort of go through that exact same progression.
You mentioned the term high load there, so I guess I have to ask, what do you consider high load training for the ski athlete? How do you kind of constitute an exercise or constitute your progression back as, oh, this is going to be a high load day?
I would say looking at sort of the number of runs they're going to take and how the course is set. So are they kind of going into a steeper trail with higher speeds that sort of stack up throughout the entire run? Or are you on a flatter trail where the speeds can kind of stay a little bit more stable throughout the actual run? And then again, we already talked about the surface, but are they on an injected surface where their speeds are going to be much, much faster and quite a bit harder on the body? Or can you maybe put them on more dry snow that's much more forgiving?
Yeah, definitely. And I think another element too would just be the overall volume that they're skiing that day. And I think this is an area where knowing the resort that they're skiing at and that sort of thing can really pay off. For example, where I grew up skiing, we had the slowest lifts in Pennsylvania. And it was 1,000-foot elevation mountain, but it would still take you 10 to 12 minutes to get to the top. So there's a ceiling, you're lucky to get 4 runs in an hour. Versus you go to some of these other mountains that have high speed lifts and the vertical is almost twice as much, but you can get double the runs in because you're all the way back up in, a couple minutes as opposed to 10 to 12, and understanding that kind of affect that volume and fatigue and, decreased rest time, I guess I'll say, could also have, on the athlete that way.
Yeah, absolutely. So, and then you can kind of get into the debate too of like decreased rest time definitely starts to stack up, but you can get through a training session much more quickly where maybe you're only out there for 2.5 hours. We've had training sessions where maybe it's 2 gondola rides to get back to the top. So you're talking 15, 20 minutes. And if we need to get 7 or 8 runs in, we might be out there for 3 hours, 4 hours. And that's when you start to look at like, okay, is that starting to become more of this like aerobic day that then taxes the athlete in a different way? That's where we've actually started using an Aura ring quite a bit. I'd say in some ways we're still collecting data and figuring out how these different days tax the athletes differently, but that consistent monitoring is starting to kind of give us a better picture of, okay, where are the athletes at and what do they need to kind of bring their body back to baseline so that they can sustain this pace for a 6-month season.
Yeah, no, I think that's such an interesting point. And really, with the data incorporation that way, every single athlete you work with becomes a case study. And you
Yeah.
can kind of, over time, figure out and fine tune what works really well for them and what doesn't. What do they respond well to versus what they don't? And a lot of times, I think if you just have the conversation with the athlete, they'll be able to tell you a lot of that on their own,
Yeah.
right? Like, at least for me, I still swear by it. There's no science behind this, but the pocket peanut butter and jelly on the ski lift, 10 out of 10 recommend.
Oh yeah, we still do it.
It's just interesting to see how that might impact all those other objective metrics and outcomes that we often think about that way. So all these little things that maybe or maybe don't matter as much as we're saying they do now. I think research and time will tell it. But I think that it's important to kind of have the conversation and bring it up because, I mean, even you mentioned the ISOs before, like I've been blown away by the difference we see acutely by just doing an ISO load or two. And it's like, is this something that like I took for granted for a long time and now we need to like really work in heavier? There's a lot of different considerations where I feel like the more we start to ask questions, the more we look at things, the more we're going to learn and the better we're going to be able to provide for the athletes that we work with.
Yeah, absolutely. I would say even my own treatment has changed drastically from the first couple years I was with the team to now. Whereas in the beginning, it was like these athletes need core strength. They need lateral stability. Like let's keep kind of loading the core and getting them strong. But what I'm finding is if we have a 5-hour training session in the morning, really the afternoon needs to be, we can't just keep loading on top of that load because over a period of time, they just kind of keep getting stiffer and stiffer and stiffer. And as we said before, they need that flexibility and they need to be able to kind of disperse the load through the entire chain. So now the afternoons for us are much more of maybe a pool session to work on maintaining thoracic mobility or maintaining hip mobility. Some of that deep tissue kind of pliability work that I took from the TB12 crew. How do we get their bodies really back to baseline and address sort of, if it's their back that's sore, address all of the muscles that sort of cross over the back so that they're not isolating that load all in one spot. They're able to disperse it through the entire trunk.
On that point on the core for a second there, what do you consider your go-to like core training or core exercises for the skier that way? Because I feel like we talked about this recently with Anthony in relation to volleyball. The core is really misunderstood and mistrained by a lot of people, in my opinion. And we think that some curl-ups and bird dogs might be enough. And then we look at the demands of the sport and it's like, oh my gosh, we are very underprepared.
Yeah, no, I think you're spot on there. I think there's definitely in some ways we need just raw strength. So we're actually adding external load to reverse hypers, or we do a ton of off bench training, sort of lateral bending, putting them into kind of using the slant boards, putting them into a sport specific position. Maybe they're in a tuck, but they're just driving one arm with a cable. So they're getting that arm drive, but they're also getting the anti-rotation from it. Maybe you're putting them in the reciprocal stance and you're doing chopping variations, but they need to be heavy enough and they need to be kind of at a pace. We might even use a metronome where it's 1 every 2 seconds for a 75-second course. So you're getting a little bit more of the sport specific duration and timing.
It's interesting. I never would have thought to incorporate the metronome into it as well. That's a really interesting consideration that way. I like that.
Yeah. And I think it almost, that external cue almost gets them to just focus on the actual movement and sort of out of their own head. So you kind of get a little bit more of a fluid motion there.
Definitely. And I'd imagine, obviously we've talked at length about the return to snow side when an athlete has been out quite a bit. But as you mentioned, you sometimes get people who come in with stuff flared up just acutely that way. And it sounds like your approach is very similar in the sense of you want to get it calmed down as quickly as you can. You mentioned that you reference, you lean on the tissue work quite a bit that way. And it sounds like you just kind of do a lot of general movement and mobility type stuff to keep them feeling good as it's needed that way. And it also sounds like you're not necessarily married to one modality or another. It's, we're willing to try anything and everything that the athlete responds well to, whether that's, you reference the pool and the water that way versus just general tissue work. I think that that's another piece that I think a lot of us get so caught up into one thing, whether it's, I'm just going to dry needle everyone, or, everyone's going to love scraping today or something like that. It's like we almost have to be slightly agnostic in our approach to making people feel good acutely and hopefully find out the magic formula that they respond really well to, but ultimately, understand that different things are going to work at different days and different times. And we have to kind of like fine tune and play around with a little bit of everything, so to speak.
Absolutely. I think some of it too is figuring out what might be causing it. I mean, in our world, we also see extremely high stress situations, high pressure. Is it the brain? Is it the central nervous system? Is it more of this like internal stress that's contributing? Like you said, like there are days where I will needle, but there are days where we focus more on deep breathing patterns and actually like calming the nervous system down. Or maybe we're actually using some PRI techniques to potentially inhibit some of these muscles that are overactivated. And I would by no means say that I'm a PRI provider or guru, but I think with a rotational sport like this, there are some positions that we can use here and there that might actually kind of get the athlete to just get into a more sort of calm state, inhibit some of these overactive muscles. And then as soon as we feel like the trunk is more in sort of a neutral position, then maybe we go into the isometrics. We actually start to gradually load so that we're kind of retraining the movement patterns.
Yeah, you've mentioned the isometrics a number of times that way. I'm really interested here. What are your kind of general parameters and approaches and progressions around isometrics for the skiing athlete that way? Are you more of like a overcoming or yielding iso fan, long duration, short duration? What kind of things are we considering when it comes to isos in the skiing population?
Yeah, this is all fairly new to me as well. So trying to mix in a little bit of both the overcoming and the yielding. I would say it's easier, especially for the back, to set up more of the kind of the overcoming. But I would say really both. And then we're kind of looking at more of that like 30-second hold, 20-second hold, relax, go into it again. But again, I would love to kind of pick your brain on sort of different positions you guys are using in the clinic with the ISOFIT as well.
Yeah, I mean, I don't feel like I see enough of a skiing population here regularly to really have like the best answers for all of it. But, I know we were talking about this a little bit before. I like to kind of set people up in different positions, whether that's, a squat type position, or something along those lines, and have them shift their weight side to side to try and mimic some of that side to side, like inversion, eversion, or weight shifting, like, oh, my weight is on this leg now, and now this one has to do this, and kind of achieving some of those deeper angles that you mentioned before. And obviously, you could have them push or pull into a bar while doing that, or alternatively, they would push or pull into the bar while moving, or alternatively, they could push and pull, get into that position, and then just hold that position there. I also think that you mentioned before about the importance of the extremes in a sport like skiing. I think that this is a great, safe area to train people at the extremes and see what they can do. I think that it's pretty easy to test anything isometrically if you have a dynamometer or force plates. So you could put someone into those extreme positions, like get them really low in a lateral lunge and have them do something there, or something along those lines. I think you can really, play around and get creative, and the sky really becomes the limit for what you can do isometrically that way for the skier. I also think that this is an area where, it's very easy to crush a lot in a short amount of time with isos. So considering skiing and where their head and upper body is going to be in relation to where they're turning and the velocity of the head in one direction while the lower body is moving a different direction, for example, I think that there's a certain element of training, even other muscle groups like the neck and spinal stabilizers, for example, even though we generally consider skiing to be a lower extremity dominant sport. Maybe it ties into lower extremity injury, maybe it doesn't, but it certainly would not hurt to be a little bit more resilient everywhere throughout the system, because freak things still happen on occasion. There was one case that I was being told about by a surgeon that way, where they had a ski slice through a girl's IT band. And it's like, how do you prepare someone for that? And then how do you recover from that, right? Like, you kind of have to think outside the box and go against the grain and kind of look at anything and everything that you can. So understanding that while the skiing world is predominantly lower extremity, freak things can still happen. And, you can get concussions, or you can get weird foosh injuries, or, they can like hit a gate a little too hard, or, every now and then we lose control and bad things happen. You never know what could happen. And I think the more in general we build a resilient athlete, the better off they're going to be.
Yeah, absolutely. Especially in a sport with so many different variables that are kind of constantly changing: course set, pitch, terrain, snow surface, snow condition. You might even have a course, especially this happens at the end of the season all the time, where we start so high that it's nice and icy and firm and consistent at the top. And then by the time these athletes get to the bottom, it's spring snow, super soft, and it's almost essentially a completely different sport in how you're having to pressure the ski.
Yeah, definitely. And I will say the other piece that comes to mind too, I think that if you can play with forces and basically just Newton's third law of action reaction a little bit, and understand like one leg could be open chain and the other leg could be closed chain, and you pushing through the open chain leg will actually create a force on the closed chain leg, also opens up a lot of unique considerations for skiing as well, because you can get that closed chain leg in extreme positions. You can bring your slant boards in and hit different shin angles, while that open chain leg could be pushing out or pushing in or pushing forward or pushing back or pushing one direction with internal rotation or external rotation, and so on that way. And you can really play around with, I'm going to use the open chain leg to create force, but the closed chain leg is essentially going to feel and experience that force as a way to kind of recreate that kind of turning that we talked about earlier, in the sense that one leg gets a lot more load than the other.
Yeah, absolutely. And what are the arms doing too? Like we'll do single leg balance drills where I have a band coming from the top and a band coming from behind, and we're basically simulating that arm drive that really creates the power for these skiers to project themselves down the hill. So are you balancing on one leg on a different surface with like a serratus push on one side and scapular retraction on the other side?
Yeah, no, I like that a lot. And, it's especially one of those things where I think we forget how closely interconnected the entire body is. And I think that, again, going back to what I've probably said it a million times now, just the importance of making sure we address and train everything.
Totally.
Because unfortunately, we're only going to be as strong as our weakest link. And, maybe that weakest link is our core and not in our lower extremity, but that could still play into a lower extremity injury, or it could impact performance on the snow that way. And obviously, if you get to the highest level of competition in skiing, these races are decided by milliseconds or tenths of a second at best. So any little thing we can do to get that slight edge in performance, we really need to be doing.
Absolutely. And I think you hit the nail on the head too. It's really looking at the entire chain. Considering the lats, like these guys that come in, they've grown a ton. You go to look at a lat test and you're like, okay, you are super tight. So then when they're in a position skiing and driving their arm forward and they have low back pain, like you got to look all the way up the trunk, look at the shoulders, look at the hips, and be able to kind of, again, get them into that mobile position and then create proper power there.
Yeah, no, definitely. And Regan, I feel like this is one of those things that we could probably talk about all day long, because in reality, we're really just scratching the surface at all of the things that go into skiing from a sports standpoint, but also a performance and rehab standpoint as well. And, I think that this is something that if people are interested in, they really need to be willing to go out and put the extra mile in to learn more. On their own. We can certainly provide the general framework that way, but I think the more effort and energy you put into it, the better off you're going to be at providing for the athletes that you work with in this space. Because unless you've skied yourself, I feel like you don't necessarily appreciate what these athletes go through.
Absolutely. And I do think that if you're working with these athletes, taking time, talk with their coaches, their coaches will have a good sense of where their energy breakdowns are, which will help you kind of guide maybe some of the correctives that you're doing in the clinic. Take time, have the athlete bring their video in. Like, we love to look at motion. Have the athlete explain to you what they might be working on, what they're struggling with. Look at the video with them, and then kind of, you can go frame by frame and sort of look at like, okay, how can I simulate this? How can we set this up with bands? So that maybe we're training their motor control a little bit better. And then I think if you're working on sort of a more acute injury, I do think it's important to recognize like, what is the tissue contributing, and realistically, what are the expectations for how long it's going to take them to get back, and whether you go down that biomechanical model with the athlete or not. I think giving the coaching staff and sort of the on snow management staff a good indicator of like what's going to irritate this and what we might be able to get away with, you can kind of help the athlete progress back onto snow a little more quickly by slowly introducing loads. But I think it's gonna take a lot of coordination with the actual on snow management crew.
I love that piece on coordination and the importance of interdisciplinary care for the skier that way, because you're absolutely right about that. And the other thing too is I think sometimes we as clinicians get so obsessed with, well, we got to correct this, we have to correct that. And sometimes correcting things doesn't always mean the best in the realm of performance. Sometimes athletes have developed a certain strategy for doing things, and that's how they do it really, really well. And we go to, quote unquote, fix it, and all of a sudden they're not doing what they need to do anymore. So understanding that the more we all work together collaboratively, the better the athlete is going to be.
Absolutely. I think that's a perfect way of putting it.
Regan, for people who want to find out more about you and all the amazing work that you and your colleagues are doing with the US ski team, where can they find you at online?
Instagram is probably the best. I would say I'm not always the best at replying, but I will get there eventually. And that's just Regan Dewhirst on Instagram. And then LinkedIn also is a good spot as well.
That's awesome. So you and Mikaela aren't doing like TikTok dances together yet, or
She wishes.
coming soon?
Actually, though, if people are interested in skiing and sort of the behind the scenes, this is a small plug for her YouTube, but she has her Moving Right Along YouTube series, which there's another season coming out this year, and they can check that out if they're interested.
Yeah, no, that's awesome. We'll have to link to that in the description below, in addition to your Instagram and LinkedIn. That way, if you didn't quite catch those things, you can just click there. Regan, this was really amazing. I really appreciate your time and all the amazing work that you're doing in the sport of skiing.
Absolutely. I love connecting with you and like-minded people. And like I said, there's really not great research yet. There's a little bit coming out. There's a core group doing some, but I think so much of it is a little bit of trial and error and jotting down everything we've learned, and then hopefully sharing that with kind of the younger generation so that they can stay healthy.